Welcome back to Good Morning El Paso. It's 6:12. As we've been mentioning, on March 10th, there will be some major changes across the state. That's when businesses can fully reopen and the mask mandate will come to an end. To discuss where things stand with the pandemic, we now welcome on Dr. Alozie. He's a member of the state's Infectious Disease Preparedness Task Force. Dr. Alozie, thanks for joining us. I first want to ask you how you feel about the governor lifting those restrictions and the impact you think it could have on public health.
Yeah, well, first of all, good morning and thank you. I think whether it's the Texas Medical Association, the Infectious Disease Society of America, the mayor, the judge, people know what the right thing to do. For the longest time, we've been saying that politicians are not going to save or help us improve our health. And so people are going to have to continue to do what they're doing. I think that we are at an inflection point where if we go the wrong direction because of the UK variant, the B117, and how it's creeping up, it may be concerning if people continue to get sick and spread transmission. I think the other thing to think about is this, Mauricio. We put in the mandate for masking when we had less hospitalizations and cases in Texas than we do now. And so I think people will make the right decision for themselves.
One thing I want to ask you about is the Johnson & Johnson vaccine. It's an exciting development in all of this as we're trying to fight the pandemic. What kind of impact do you think this third vaccine will have on us here in the borderland?
Yeah, well, I'm super excited about the J&J. One shot requires a normal refrigerator, doesn't require the ultra cold fridge, and it works, right? I think people get caught up on some of the headlines that have been put around the 62 and 72%. What's critically important is that it's 100% effective against hospitalizations and death. All the vaccines are. And so people should not quibble about the efficacy of what happened versus Moderna and Pfizer. I think the other thing which is really important is that right now, Texas is 45 out of 50 when it comes to states and the vaccination per capita. One shot can speed up our community, specifically here in El Paso and across the state, vaccinated. So I think we really need to focus in on this Johnson & Johnson one-shot approach and get as many people vaccinated as possible, because that's what's going to get us out of here. The masking is one piece, but the vaccination is the hope that people need to get to the summer. Some have called it a potential Woodstock summer if we can get enough people vaccinated.
Hey, Doctor, lastly, I want to get your sense of where things stand with the pandemic in El Paso. We mentioned earlier today that hospitalizations dip below 300 patients. This is for the first time since October. So are you optimistic about these next couple of months? You think we've turned that corner?
Yeah, I don't want to say whether we've turned a corner or not. I will latch on to the optimistic. I'm very optimistic about where we're gone. We've seen rates and cases drop across the city, county, state, and country. We need to continue that momentum. The only way we're going to continue that momentum is for people to continue to be safe, wear masks where appropriate, get outside. Being outside is huge in terms of protecting yourselves. And when the time comes, get vaccinated. Let's not have vaccine hesitancy. And if I can make a sort of shameless pitch, on March 13th, I'll be partnering with the doctor out of the NIH that went to Tuskegee to talk about vaccinations in communities of color, and really important for people to get on that webinar and let's talk about the questions and the myths.
Hey, there's no shame in that pitch. Dr. Alozie, we thank you so much for your time as always. And we'll go ahead and send things over to Hillary now.